Tambo International Airport, a new hub where humanitarian workers will be departing from to different parts of the globe to provide aid and assist in the fight against the global public health pandemic. The United Nations has established this hub as a temporary measure from the approval of President Cyril Ramaphosa.
The primary mission is to facilitate, of course, your people's mobility, humanitarian relief workers. We have Doctors Without Borders. We have your logistical support to the World Food Program and to the World Health Organization. And I think we appreciate that apart from the health pandemic and the challenges Africa faced as it relates to the health front, a key issue is about food security. So part of the 69 relief workers, we also have your food nutrition specialists that will work closer with other governments. So they will be distributed to 20 countries once they land in Ethiopia. From the Central African Republic, Somalia. I think now what it does, it expedites your humanitarian movement of people, but it also serves as a hub for humanitarian cargo. So interventions about your food security, food parcels from the United Nations, all will come via this humanitarian hub. What complements our efforts to fight the pandemic, it's of course to have your adequate human resource capacity in place elsewhere in Africa, not only in South Africa. So this partnership between South Africa, the African Union and the United Nations seeks to deepen that type of collaboration so that your social infrastructure elsewhere in Africa is staffed with the same capabilities like in South Africa.
Africa's continental approach in fighting the pandemic is what is believed to have contributed to prevent the rapid spread observed in the United States and across Europe. 2 hubs were initially set up in Ethiopia and Ghana, and with the number of infections in Africa rising, an additional hub in the south of the continent will boost response efforts. Africa currently has over 320,000 confirmed cases with more than 8,600 deaths. This hub will also be used for the transportation of personal protective equipment.
The cargo comes from China, from Brussels, from Atlanta, so intercontinental, into Southern Africa via Johannesburg. It arrives in the airport with these flights, and then it's taken to a staging area, a warehouse very close by OR Tambo, where we are repacking it and then sending it beyond to the different countries. For example, from here, from South Africa, we move by road to Lesotho, Eswatini, Namibia, Zimbabwe, Botswana, and Mozambique. And also we move by boat to Madagascar and Comoros, for example, that are island states that have problems as well. So basically, there is a whole intercontinental link to make sure that all humanitarian workers and passengers move, but also essential cargo that is required.
The UN, the World Health Organization and the African Union have stressed the importance of a global combined effort in the fight against the pandemic. As the world yearns to return to normalcy, the international agencies have warned that the pandemic is far from over. Collaboration is important now more than ever.
African collaboration and global collaboration is very, very critical at this point in time, because remember, we live in a global world. A virus which originates in one part of the world travels to the other part of the world within a matter of few hours, and we see within 6 months now, I mean, we are crossing 10 million cases and more than 500,000 deaths globally. Having said that, I mean, in Africa the virus has come in and has not peaked yet, but it's moving in that direction. And South Africa, as the chair of AU and also playing a very important role in SADC, has to play a central role. And this establishment of this humanitarian hub in Johannesburg is one of the parts to it. Global collaboration is also important not only for the movement of humanitarian workers, but also for medicine and medical products. And that we've seen a huge constraint in. So with the establishment of this hub, I think this will definitely provide a lot of impetus to the response in the whole region.
An effort recognized by essential frontline workers.
My final destination is Sierra Leone. I'm going there for a mission which will be for 1 year. I was supposed to leave in March for my mission, but because of COVID I was stuck here in South Africa. I was very happy because I was able to help out in South Africa as well, but there is a lot of need also in Sierra Leone, so that's why I'm going there now to help with whatever needs they have. So they have quite a lot of COVID cases. Obviously there's a lot of Ebola that was there before, and there's rampant malnutrition that's ongoing.
There's a lot of operations in Africa that still needs to continue. Our operation helps out with supplying medicine to the fields and the areas, very small areas. So I think it's a crucial part helping out during this epidemic.
As Africa's curve continues to steepen, more aid workers will be needed on the front line as health systems see more and more patients, and operations such as this hub will be stretched to capacity. Zolega Kotashe, SABC News, Johannesburg.